My name is Erica Wood, and the topic that I chose today was punishment. The journal article that I chose to expand on and critique is Suppressing Tantrum Behaviour in Public Places Through the Use of Delayed Punishment Mediated by Audio Recordings. This was written by Amos Rohleder and Ron Van Houten and published in 1985. Amos Rohleder and Ron Van Houten have published over 10 works together. Most of their works, both together and with other authors, were strongly based on behaviour and behaviour modification. Another article that they wrote together was the use of brief movement restriction procedure to eliminate severe inappropriate behaviour, which was published in 1991. The reason I chose this journal article over other journal articles was that it was quite a different way of obtaining the child's behaviour through audio recording, and I thought it was good because it enabled the child to actually hear and understand their tantrum behaviour, which was deemed unacceptable. It was also interesting because it was an example of successful delayed punishment, whereas most other readings that I've come across stated that for punishment to be successful, it had to be implemented immediately. An article that Rohleder and Van Houten worked off for their study was evaluation of family intervention through unobtrusive audio recording, experiences in bugging children, which was published in 1976 and written by Johnson, Christensen, and Bellamy. This involved studying 5 children with an audio recording device, which was recorded at random times throughout the days. It also showed an increase in compliance among children. The reason for Amos Rohleder's and Ron Van Houten's study was to look at delayed punishment as a form of parental discipline, particularly if the disobedience occurred in a public setting where immediate punishment was not always possible. The aim was to evaluate whether punishment involving tape mediation for inappropriate behaviours would reduce these behaviours in public. The hypothesis that they stated was that if mediation and movement suppression is applied, then tantrum behaviour will reduce even though punishment is delayed. The participant was a 10-year-old boy named Michael who had been diagnosed as psychotic at age 5 and who often took part in disobedient behaviour. The methodology involved Michael's tantrum behaviour being recorded during his daily taxi ride to school, waiting at the bus with his mum, and on the bus with his mum. A tape recorder recorded the tantrum behaviour across 90 different sessions. During the baseline condition, tantrum behaviours were recorded with the recorder, which was hidden from Michael's view. There was no instruction from the experimenter on how to deal with the tantrum behaviour. During the movement suppression condition, the tape recorder was placed in view of Michael during these 3 settings. He was told that he was being recorded. At the end of the day, Michael's mother took a 1-minute segment from a tantrum throughout the day and showed it to his father. The movement suppression condition was then implemented immediately, where Michael was taken to the corner of the room with his chin in the corner and his hands behind his back. He was not allowed to move at all, and if there was any sort of disruption, movement, or talking, he was told, "Don't talk, don't move," and pushed back into the corner. Michael was allowed to leave after 20 seconds if there had been at least 15 seconds with no disruption. This was repeated 3 times for each assigned segment. The presence of the recorder was faded out over many sessions. The follow-up condition then took place, where the tape recorder was again hidden from Michael's view. The results showed that the hypothesis was supported and that tape mediation and movement suppression were applied and tantrum behaviour was reduced, even though punishment was delayed. In the baseline session, punishment took place an average of 43% of the time across the 3 sessions. By the time the follow-up session came, tantrum behaviour only occurred once in the bus settings and not at all in the other settings. There were 45 follow-up sessions. The researchers concluded that tape recorder mediation punishment was able to suppress tantrum behaviour in 3 different public settings for Michael, even though punishment was delayed many hours after the tantrums. Some limitations of this methodology include that it only took place with 1 child. Therefore, it cannot be generalized as the sample was not big enough. The tantrum behavior was only recorded in 3 different settings. Michael may have discriminated from these settings to other settings and only reduced his tantrum behavior in these 3 settings that he knew he was going to be recorded in. So therefore, it cannot apply to other settings. The mother had to have the tape recorder on her at all times, and tantrum behavior was only recorded when the mother was around. As it was recorded in his natural environment, there was little control over extraneous variables. For example, there could have been other children on the bus who strongly irritated Michael. There could have been experimenter bias. The experimenter could have observed minor tantrums, especially in the follow-up situations, and ignored them, leading to confirmation bias. The study was only based on positive punishment, therefore it cannot be applied to other forms of punishment. Bandura coined the term modelling. Modelling can help to explain when someone is punished that they have the tendency to go and punish someone else. However, this does not apply in the case of reinforcement. Therefore, a study by Bernard et al. In 1977, teaching children appropriate shopping behaviour through parent training in supermarket settings, may have been a more appropriate study, as it used token economies and positive reinforcement to control child behaviour in these supermarket settings, which led to an increase in desired behaviour. And this reduces the chance of the child going out and punishing somebody else. The method was successful in that the baseline situation was able to be performed without Michael knowing, and it was in his natural environment, which should indicate that his behaviours were quite natural. There were 90 sessions that took place, which should have got a good idea of Michael's tantrum behaviour across these situations. And the punishment was quick and easy to administer, and required no setup. Michael was able to hear exactly what he had done wrong later in the day when he was being punished. This is probably why the delayed punishment was successful, as Michael knew exactly what he had done wrong after hearing it on the audio device. And the study was also ethically sound. This experiment, however, does appear to disprove Moffat, who suggested that punishment must be applied immediately, otherwise it has little effect. However, the relationship in this study is only correlational, and causation cannot be proved. The study was also good because it did not use corporal punishment on the child, which has been shown to start a cycle of violence, whereby the child uses physical punishment and aggression towards others because their parents have done so to them. This was shown by Simmons and Wirtel in 2010. The results stated that the methodology used completely abolished tantrum behaviour in Michael. However, it may have only been across these situations. And even in the follow-up session, there was one situation of tantrum behaviour, which indicates that it was not completely abolished. The author's conclusion was quite accurate and in accordance to the study. It was specifically about Michael and was not generalised in any way, and it was only relevant to the 3 situations. Therefore, the internal validity was quite high. However, it posed no external validity, as it couldn't be generalised at all. Things that could be done differently for this study in the future is that they could have combined punishment and reinforcement together, which reduces the chance of the child using punishment on somebody else. They could record over more settings, not just the 3 specific settings, which will better enable the study to be generalised. They could use a much larger sample, which would make the study more replicable and more easily generalised to the general public. They could do the study with single parents and non-nuclear families, not just a 2-parent system. They could do a study with both diagnosed and non-diagnosed children, and also with children who have a history of behaviour problems and those who do not, as this will allow it to be more generalised and cover a more broad sample. Thank you so much for listening.